This
people.
conference will now be recorded.
Sorry, I remembered.
Yeah. And just kind of more information about what we do. We have kind of lumped the things that we're working on as building and sustaining coalitions and partnerships, and then training, education, advocacy, and networking. So all of the things on this page will fall into one of those two categories. Next is the membership. We're wanting to make sure that we have a link on the homepage and then also on this membership page for people to sign up and become members. Just kind of streamline the process from where we're at now. But this just kind of highlights why somebody would want to become a member, what they can expect from that, giving some more information there. The who we are just kind of covers the board members for now. We need to get an updated picture next time we're together in person. Who we serve, this is something we've been working on. It's an interactive map that will feature any current members on the map. So you'll be able to the county and then see my counties, Fayette County, that there are 2 coalitions, and these will then link to that coalition's webpage. So pretty excited about that interactive option there.
Real quick, I just want to remind people, if you're not speaking, if you would go ahead and mute yourself now, that'd be great.
So that is kind of the overview of where we kind of see the website going. This is not live yet, but it's something we're still kind of working through. So one of the other things that the Capacity Marketing Group has been working on are the case statements. So these are the documents that can be provided to either potential partners, whether they're local partners, state partners, and they could even be federal partners, and then also potential members. So this case statement has been approved. We are ready to print it, and we've received approval for printing cost. This is the one that we would provide to potential partners. So it just kind of gives an overview of AC4C, the activities that we do, the things that we do, some numbers that just are kind of featured from our last evaluation, and then of course the contact information. We did also show the timeline of kind of the changes that have been made through the efforts of AC4C over the past years, 13 years there. And then this one is called 5 Reasons. This one is intended for potential partners. Capacity Marketing is currently working on a plan with a letter. This will be sent out with that letter to all coalitions and potential members across the state in the coming weeks. So this again just kind of covers what we do, how we add value to kind of prevention work, what members could expect from us, and then the 5 reasons are really just kind of trying to bring people together, as that statewide coalition. These documents are available for you. If you want to use them, just let us know. They'll eventually be on our website, and so they'll be easily viewable there. But, and if for some reason you need paper copies of them, we'll have those as well. But those are our case statements and website. Any questions on that?
Thank you so much for sharing all that quickly. So,
yeah.
All right, I'll move it back over. Oops, to me. I think this is me. There we go. All right, and I am going to share a different. See, we're going to do the organizational chart. This is, there we go. Just trying to do a little bit of an orientation here, and we thought our website will be a good place to kind of orient yourself if you're newer to our coalition. But and started an organizational chart. We may change this up a little bit yet too, but just so you kind of get an idea, because we were talking, really probably some of these teams don't report all straight to the board, those kinds of things. But as far as funding, it flows down from Office of National Drug Control Policy right now through SAMHSA, soon to be CDC. You know that if you have a DFC. Office of Drug Control Policy, the state, Iowa Governor's Office of Drug Control Policy is our fiscal agent, grantee, and official business official. So, and then our board, which we've introduced ourselves as well. And actually ODCP, Dennis Wiggins, is our, on paper, project director, as very, very small percentage point. And then I am the staff here, like we mentioned. Ryan is youth coordinator, and Mary Schissel, who will present at our next meeting, hopefully in person in September, and is our evaluator. So Mary was one of our original founders of AC4C, and probably 15 years ago at least. And then these are the different work groups and action teams that we have under AC4C. So we have AC4C youth group that Ryan is running, and so we have like an adult participate. We're going to have some of the kids joining us tomorrow morning, and then I don't know, and then capacity and marketing, like Sue and Stacy. I'm running the policy work group, and then we have the action teams that meet every Monday at 9:30. So we actually, these aren't in order of the meeting. It actually goes not even in backwards order. Okay, other substances the first Monday, then we switch over. Marijuana is the second Monday. Nicotine is the third Monday, and alcohol is the fourth Monday. We just met yesterday, and we'll have some highlights from those groups and what they've been doing in June, and capacity, what they're doing today, tomorrow morning as we recap. So any questions on the organizational chart right now? We may change this up a little bit, but it was a first draft. So okay, I'm going to move on to just a quick highlight on our action plan. We spent a lot of time, I know a lot of people are new today here, but at our last couple of retreats, we've spent quite a bit of time on our action plan. So just kind of go over the main goals with DFC. If you've been that, increasing community collaboration is always their goal one. And so that's our main funding source. So that it is objective one is just to actively engage voting membership. We were currently at 30 by 10%, at least 3 voting members by October 30th. So we can talk, I should have, please let me know if you'd like to, I'm going to work on membership forms, but we're having that, as Stacy, I think, talked about, through the website, as well as we can do the old fashioned way with some of you filled out actual paper, or you can fill it out by online and send it back to me. It's just really nice to have everybody's contact information and try to keep that up to date. And so I may be contacting some of you who are newer to get your membership form, so we can kind of help merit and keep track of true members in our coalition. So, and so I'm not going to go through all the strategies because I want to leave some time here. I think Sarah Persons is going to be joining us from Children and Families of Iowa, and then Peter's going to talk just a little bit too. But you can kind of see some of those things are the capacity type building activities. And then we have what we're doing right here, even orientation, and we are kind of known for our day on the Hill and our prevention conference, and we're trying to reach the youth more, and with our having now the youth coordinator and youth group. And then here's our 2-day work retreats, a lot lower cost right now, and we don't even have to do lodging, but we hope we can be in person again. And then soon. And then there's all our action teams like we just talked about. So, and goal 2 is reducing youth substance use. And objective 1, we have our 2 main right now objectives are alcohol and marijuana. And so this is going to be a little tougher now that we don't have a 2020 Iowa Youth Survey. It'll be a 2021. So Mary's working on that and trying to figure out some different things. We are hoping maybe we can work together as a group and do some do more, survey monkey type surveys with kids and get the questions that are needed for your drug-free community grant requirements, and work together as a state then to maybe have some data for the federal every 2 years is a requirement. So we're in a little bit of a lurch there. All right, so anyway, main thing is what we are trying to reduce access to alcohol, which is a tough one in this environment that just keeps going the other direction. And so And so we have many strategies working on that. And so you can see we're working on toolkits and different things. I'm just gonna, there's a lot here. So maybe we'll kind of hit some of these when we do some of our reporting tomorrow on our work groups. We're working with ABD and pretty quick here, Cassie will be on, and we'll be working with, we're working with NABCA now as well. And then we're working on some of the main strategies. We've talked about our age of seller, beer excise tax, working on also some hard liquor price and funding strategies, alcohol outlet density. We've been talking about and looking at new ways to approach that, responsible beverage service training, being hopefully working on the code so it's more easy to require RBST and alcohol compliance check system, which would take some more money. Those are our main ones. And and then the marijuana, same thing, reducing easy access, hopefully by 2%, and we'll have to change our, since we're not having the IOU survey this year, but we'll change it to something else here. So, and we are doing some different things with zoning ordinances, working on that, doing some podcasts. I think maybe there was a little talk on that yesterday with if you did the taping of the Surviving Bad show, Peter will talk about next. Okay, I gotta keep moving. So different things on marijuana. We did also really put a third objective, so a second one under marijuana on trying to improve the number of kids who are no longer thinking that marijuana is dangerous. So anyway, we are trying to start a new campaign on that. The youth are working on that, as well as we're doing an adult campaign hopefully soon. And that is it. For next year, we're talking about adding in a little bit, just one little objective and a couple strategies on methamphetamine, I believe, or yeah, for year 7, but that won't start until November. All right, that is kind of our overview. Any questions on the action plan that I know is just a kind of a short, quick? Any questions about that?
I have a quick question. This is Heather.
Yeah.
With the diversity situation that's going on in the country right now, and I know around Cedar Rapids and around this area, they're trying to get marijuana legalized because they're saying more African Americans are being arrested because of that. Is that something that we need to look at as an action as far as diversity in all of this?
Yes.
Was that Maggie?
So this is an issue I've been bringing up a few times. I unfortunately, both Laurel and I have a meeting at 10 o'clock. So I'm going to have to make this short and concise, even though I feel very strongly about it and could go on for hours about it. But our agency, we kind of side with Smart Approaches to Marijuana on this, and SAM, or Smart Approaches to Marijuana, is in favor of decriminalization, but not of legalization or commercialization. And it's very important that we make sure to distinguish between the two. And one of the things that's important to point out is that with decriminalization, well, I should say it this way, when people are talking about legalizing marijuana in order to address those disparities that are in fact there, especially in Iowa. Iowa is among the top 5 in the nation for disparities in arrests for possession of marijuana. African Americans are 7 times more likely to be arrested for possession than whites in the state of Iowa, and that's the 5th worst discrepancy in the United States. So people oftentimes talk about legalization as a solution. And so the first thing you want to point out is that what you want to ask people, what is it that you're trying to achieve with legalization that you cannot achieve with decriminalization? Okay, and just to be clear, the difference between the two, legalization allows for people to start selling it. That's where we're looking at pot shops, and that's what we would see being very harmful to communities of color and to poor low-income neighborhoods. Okay, so that's something that would actually have the opposite effect of what people are seeking it out for. When you look at what tobacco and alcohol have done, how they are targeted for people of color and in neighborhoods with people of color, it's been devastating. And so that's why we definitely want to push away from commercialization. Okay, with decriminalization, we take away the arrests for first offenses and just treating it more as like a fine. So for instance, here in Nebraska, because like Laurel said, we serve both Nebraska and Iowa. In Nebraska, it's considered an infraction. It is not a misdemeanor. So it's not a criminal offense, the same way that we know that speeding, traffic offenses are against the law, but they don't go on our criminal record, right? And so I think that it's worth exploring. Like Jennifer Huseman, she texted me yesterday after seeing a news clip that I did and said, I could see maybe taking away the jail time as being beneficial. So I think that it's worth exploring like what we would want to see decriminalization look like. But I would say that it's definitely something that we all need to explore and definitely take a look at, because while I am dead set against commercialization of any kind, I'm completely against medical marijuana bills that we see in most states. We see that decriminalization could have a much more positive impact on the diversity and the things that we're talking about a lot in the media at this time. So with that, I don't mean to preach and then leave, but I do have a 10 o'clock meeting, and Laurel and I will probably, at least I will be back on a little bit later today, but I do hope that this is discussed more.
Yeah, and Maggie, we definitely need to talk about it a little bit more and see if we want to have a stance, but I think we pretty much all, at least I know our sheriff in Jones County had always said, at least not having it as high for the first offense, money wise, and simple misdemeanor, or very small amounts, and first time being decriminalized. It's a trick, that's for sure, to figure out what is the right thing. We want to have, like Ed Gokak talked about, you want to have some basic laws so we can have a diversion chance, to say, hey, instead of, if somebody's, got more marijuana on them and they've got a second offense and things, you want to be able to say, you know what, if you'll go to treatment, and at least they get education that way for the first time. If they go to outpatient treatment or something, they, instead of going to jail or, having to pay some high fine or whatever it is. So some little backbone to be able to, okay, enough of that. Right now we needed to switch gears to alcohol, back to alcohol, because we are, but Peter, you have to do, I don't think Sarah Persons joined us after all. I don't see her name on the list yet. So Peter, would you just give a 5-minute talk on what you're going to do? Because we had so many state partners. I asked Peter to present today if he could before we start our break. Peter, are you able? Okay.
Can you guys hear me?
Yes.
Can you see me? No. I keep losing the video feed.
That's okay. Don't worry about it. We can hear you.
All right. Well, we're concerned with a lot of things. One of the things is, and this was one thing that Maggie brought up, let's talk about it. There's a movement, especially with Black Lives Matters, to legalize marijuana. Again, this is problematic for us because we have two issues happening at the same time. We have a desire to limit policing in many aspects. And I think part of the discussion that's never brought up is the fact that our police officers have been turned into interventionists. We have programs for them to do triage. I mean, they are a last line of defense for intervention with substance use. When we don't have it any sooner, we have a problem. So to divert money from a viable intervention source, and that's true with alcohol and other things. I mean, unfortunately, by the time police deal with people, it's way past a reasonable level for an intervention, but to eliminate that intervention, holds tremendous risk unless we can figure out ways to create constructive interventions to substance use disorders before they manifest themselves in mental health issues and criminal activities and other things that are bound up in this whole dysfunction of substance use disorder. And so what we're doing is we're probably opening the door to increase the stigma associated. I mean, anytime you don't have proper interventions, you have more people that fall through the cracks at every level. So it's very reasonable to say we need more mental health funding, more prevention funding, but to take a last line of defense for an intervention when people are probably most destructive societally away without finding a methodology to reduce the incidence of those problems before you remove it. I mean, I'm not for police violence. Nobody is. Nobody wants to see any person of any color, of any religion, race, whatever, persecuted for any of their activities. But we do know that legalizing marijuana does not reduce substance use. We know in the states where they have legalized marijuana, the disparity with minorities and blacks being arrested and prosecuted has either stayed the same or gone up. So it has not helped with the issues they're trying to confuse them with. So this is going to be a tough one for us. And it'll fall back on us on the whole marijuana thing. Anyway, what we're trying to do is we're doing a lot of TV shows. We're doing FaceTime live shows. We're doing weekly. Next week, we do a show on racism with 3 Black leaders from around the state. This the last show we taped had Laurel Muting on there and Kristen Husingay and Cassie Schrader.
Stacy
Schrader. Sorry, Cassie
Schroeder. Yep.
Schroeder. Yeah, she's here. She should be here somewhere, I think.
Yes, she is.
And so, and we talked about this a little bit. We talked about, how marijuana is enjoying sort of this resurgence and the problems with it, all the different standards. And in prevention, we all know that the access to these drugs by youth is tremendously dangerous. Sets a long-term precedent for nothing but predominantly bad outcomes. So now we're going to be caught in the crossfire. Are we going to be racist because we don't support these programs? Are we going to lose a strong connection with public safety? Because, I mean, the public safety professionals in the state, 99% of them are good people. Just like the largest percentage of kids we talk to in schools are good kids that aren't going to do drugs or alcohol. In many cases, we're trying to inform them and educate them to be better mentors for their peers. So we reduce the statistical probability of the problems associated with substance use disorder within their peer groups by having them being able to mentor these messages. Well, that same thing, I think, would be the application to public safety officers and police officers. Don't throw the baby out with the bathwater. Turn into a functional system that addresses the problems more effectively. And so statewide, we're seeing a lot of confusion on marijuana, on drugs. For some reason, drugs has become, and the enforcement of drug laws and dealing with drug issues has now become a issue of racism. And this is going to be a tough one for us to deal with, and we need to figure out a way how. And we probably need, I mean, let's look at this meeting. I can't see all the videos, but how many people of color are involved in this organization right now? Or at this meeting?
I don't know for sure either.
I don't either, but I think we probably need to do some work to get some involvement from organizations so they feel represented in what AC4C does. Same way we in the partnership feel it's important that people of color are represented. And that is that, there are a lot of minorities in Iowa. It's not just one color. It's a matter of embracing humanity and people across the board without bias. So I think in the prevention world where we're seeing this push towards mental health services and everything else, we face the risk of getting squeezed out too if the primary prevention knowledge we hold resonates with some things that can be effective in this culture, like constructive interventions where we can keep people that are a danger to themselves and other people off the street, as well as the legality of certain substances like marijuana. I mean, we need to make sure that dialogue stays true to what we do in prevention, because we have 2 extremes here with substance use disorder problems. We have public safety, which is the final intervention, and prevention, which is the first intervention. If you want to look at it that way as a spectrum, if they're willing to cut the head off on the final end of this, of the dragon, what are they going to do with us when they realize that we don't want this anymore? So we almost have to look at this holistically and say, you know, we've got to defend the rights of public safety professionals to enact constructive and healthy interventions without necessarily leading to incarceration and prosecution, which they're doing. We have these new triage programs being developed around the state to divert people from law enforcement. So we got great stuff happening that nobody's talking about enhancing that and making that stronger or better. They're talking about shutting it down.
Yeah, and that's the very thing. We're actually working on a diversion program right here in Jones County with Black Hawk and Story County with ODCP, and you know, that's what you just got to be careful of, is this, you know, decriminalizing everything. You won't have any way of then helping. I always say, and some of you have heard my son's story, but if it wasn't for the law enforcement, and he's got major, you know, mental health and has a substance use disorder in recovery, thankfully, for over 3.5 years, but if it wouldn't have been for law, you know, having some backbone, having that law, we wouldn't have been able to get him help. I could have done everything I think possible, but that was the only way, you know, that he ended up getting in trouble. The law. Okay, we need to take a break and start thinking about what's going on with alcohol in our state. You know, we've had some. If you haven't heard, we had there's a bill on the governor's desk to continue the to-go containers, the drive-through margaritas, just like you're driving through McDonald's for a lemonade. So be thinking of all those things that are happening in our state, and take a quick break, and we'll get ready for having Cassie up next. Stand up, stretch, you guys, it's important when you're doing these longer days. So I'm gonna do it too. Cassie. This is our first time of doing like a whole retreat like this, so this is kind of interesting. All right, some people, I'm going to get to view right now. I'm going to share your screen here. Right, there you are.
Good, Lisa, how are you?
Good, how are you? Put your, go ahead and mute everybody, please. Except for, there we go. Hi, Cassie. Okay. I've got it on, you're the, yes.
Okay, great.
And I've got you as the presenter, so whenever you're ready to put up your PowerPoint, you can.
Okay, I will do that. In fact, I'm going to go on mute because I just have to make a quick phone call before we get started.
Yep, no problem. I will too.
Can you hear me, Jennifer?
Hey, Cassie. Yep, we took a break too.
No problem. No problem at all. Take your time. I'm just going to pull up my slides here.
I wish I could share with you all what I am having for my break. My wonderful the receptionist secretary here just brought us in fresh strawberries, melon, pineapple, grapes. I mean, I don't know if you can see it, but
I see it. Nice. Yeah.
I shouldn't even do that. That was kind of mean.
That's okay. That's okay.
Oh, goodness. Let's see. What time is it now? Look on my phone.
Yeah, I have 11:10 or 10:10 for you guys.
Yep, 10:10. Okay.
You know, I have to tell you, Jennifer, I remembered like this morning early. I'm like, oh, they're an hour behind. So I was thinking 10:15 in my own head. So I was like, well, I gained an hour.
Oh, goodness. Yeah. I have to think that through every time with the meetings, the other meetings, I had written down the 3 to 4 on my calendar at first. And then I'm like, nope. But thankfully the calendar invite got me straight, because it went ahead and automatically went to my time.
Yeah, I looked back at the agenda just to confirm like you weren't talking my time, just to make sure. But yeah, we're all set. I'm here, right? I got
I
here.
was forgetting that you're so far away,
Can you see my slides?
Yes, I can. And I maybe should tell other people that they can put it so that they can see you as well. Like, so under the webcam, if anybody's looking, they can see view presenter only. So we can see you and the slides, or, you can make the slides bigger but it looks nice and big right now.
Everyone can control that, you're saying.
They're themselves. They can control it themselves, I believe is how GoTo, it works for me anyway. I'm hoping it works for everybody else. Oh, Susie sure has arrived. Let me see who else has joined us new. Hi, Susie.
Whoopsie, that's not what I wanted to do.
Yeah, and I should have told people, I don't know how many people are back from break, but if David could have introduced himself in the chat if he can hear me. He's online. I can't hear her, Jennifer. You can't hear Cassie? Oh, that's because I changed my USB. Thank you. Hang on. Because I changed it to my phone for a little bit. It's like I'm running out of USB spots. Okay. Put that one away.
Hey, Jennifer.
Hi. Was that Susie?
This is Angie. My daughter came out and said she was part of the AC4C retreat. I said, no way. I got to say hey.
Hey, yeah, we're on break and just coming back from our break. So, okay, the recording is still going. Oh, shoot, we forgot to unrecord.
That's what she said. So
we just recorded the whole break, but that's okay. Now we won't change it because we're just about to have Cassie Greason. You remember Cassie, Angie?
Yes,
Angie?
I do. Hey, Cassie.
Hi.
So we had a fun thing is that her daughter, Hannah, is doing her internship with Pathways. I don't know if you heard that.
That's awesome.
Yeah, that introduction. But so nice to have you with us, Angie.
Yeah. Hello to everyone.
You don't have a camera, do you? Let's see. We're about to start here, but whoop, I did the wrong thing. Undid my, that's okay. All right. Let's see. All right, let's see. Have that hidden. I'll look and see if there was anybody else. Yeah, I saw Susie joined us. There's 30 people on now. See if there's anybody else new that I noticed. Denise Roberg is here now from ABD. Wonderful. And she's back. And Susie. So Susie Sure from Office of Drug Control Policy. Those are the only ones we hadn't during the beginning introductions. So, okay, Carmen, you can hear good now, right?
I can hear you really well. I don't know that I can hear anybody else.
Okay, Cassie, you want to say hi?
Hi, everybody. Test.
Yep. Great. Thank you.
Yep. Okay, and time 10:14. So about 1 minute. We'll give people, make sure they're back from their bathroom break or their fruit. I might eat while you're talking.
That's okay.
Take the webcam off myself. So I'm one of those hackers on these Zoom meetings. I call them Zoom. It's like saying, Kleenex instead of tissue.
I agree.
Okay. Well, I think it's probably 10:15. So welcome back, everybody. Go ahead and mute yourself. So we are so lucky. I'll let you introduce yourself a little bit, Cassie, but I want to first say just thank you for being here with us. I mean, we're thankful that we didn't pay you a dime. I don't know if we should have, but anyway, I don't think so.
Free.
We're so thankful for your expertise and thank you for being with our group from Iowa. There were a couple people from Nebraska here, but I think they had to go. So yeah. So anyway, but maybe Maggie will be back at least today. So we'll go ahead and let you take it, and you can introduce, tell us about who you are.
Sure, no problem. And so I'm just going to try to figure out how to close out all your great faces I can see, so I can see my own slides here. Just give me 1 second. It's not letting me do that. Do you know, Jennifer, how to do that?
Okay, so let's see. So on maybe down at the bottom right corner. Okay.
I see it. No, that's bigger.
I made it bigger?
Okay. It did. Yeah.
Make your own. I can see mine.
Oh, you know what? I did. I figured it out. So okay, that's the good news. Okay. So good morning, everybody. I'm Cassie Greisen, as Jennifer noted. And what I've been asked to talk about is balancing the narrative. I'm trying to minimize my screen here. Sorry, guys. Just a little technical difficulty, but now you can probably, let me do this. Okay. Can you see this still, everybody?
And I think we can, yep, I'm seeing it really well. And we can control, I think, on our end, whether we see you or not.
Perfect. Okay. Very good. So balancing the narrative in alcohol policy debates, that is the topic of the conversation today. So I'm really feel fortunate to be able to have this opportunity to tell you a little bit about my background and about our organization. So for some of you, you maybe heard me with the Iowa Department of Public Health speaking a couple weeks ago. So you may have already heard a little bit about NABCA that you were not familiar with, but let me just give you a quick refresher. NABCA is the National Alcohol Beverage Control Association, and we were established shortly after federal prohibition was repealed in 1938. So we've been around for just a little while, and our primary membership are states that are alcohol regulators, but also states that sell the product, like Iowa. So that's our governing board members are states that sell the product in some way, shape, or form at wholesale or retail. But the primary bulk of our membership is, in fact, alcohol regulators across the country. And we do have membership from the beverage alcohol industry, from all three tiers, from public health, public safety, from international contingencies. So we have quite a large tent of membership. And it's important to note we're not an advocacy or lobbying organization, but we're also not a beverage alcohol industry organization. So we're kind of, trying to bring the best science, the best data to inform alcohol regulation across the country. Now, a little bit more about me that I don't think I got to share as much when I was speaking for the Iowa Department of Public Health, but I'm the Director of Public Policy for the organization, and I've been doing work in alcohol policy for close to 15 years now. And I started at the young age of 22, fresh out of college in Omaha, Nebraska, working at a statewide nonprofit where I led 3 different county level coalitions. And in that role, our primary work was to prevent youth access to alcohol. And in that role, I did quite a bit of partnership with alcohol law enforcement to do underage compliance checks and saturation party patrols and sort of monitoring our Liquor Control Commission hearings. I did quite a bit with high school students and helping them raise their voice and engage in these policy discussions in their communities. And my technical training is in media, public relations, and so I bring that kind of skill set to the table as well in terms of knowing how to write op-eds and letters to the editor and engage with the media. And I brought that to that particular role. So I was there in Nebraska. I mean, I'm born and raised from Nebraska, so just right there, neighbor state to Iowa. And so I really do understand sort of the Midwest Plains, heartland kind of mentality around these issues. Recognizing though every state still is very different. But so, for some of you who are, on the ground doing prevention work with coalitions, I've been there, I've done that. I've also helped kind of guide 10 coalitions across the state of Nebraska from the east to the west coast to try to help them move policy related to prevention of underage drinking. Then in 2013, I had an opportunity to go and work with Dr. David Jernigan. Some of you might recognize that name. But at the Johns Hopkins Bloomberg School of Public Health, where I, at that role, got to do a lot with college campuses. And before that time, I really hadn't worked quite very closely with college campuses in their prevention work. But in this role, I got a really up close and personal experience where I helped 3 different universities pass social host ordinances locally in their communities to civil social host ordinances, to be clear, and to try to address their college drinking issues and sort of hit where the high risk drinking was happening in the setting. And then from there, I, have taken on this role as the director of public policy. And my primary role is to connect public health, prevention, and regulation. And while I don't advocate in this role for any particular policy, I do certainly, as an individual citizen and formerly living in Baltimore City, I work with the Baltimore Good Neighbors Coalition to bring my expertise to those policy debates that are happening through that coalition. So, sometimes we can't act in our professional role, but we can as a personal citizen in our own communities and bring our expertise and knowledge to bear, which I certainly do on my own time. And I just think that's important to say out loud because you all have that opportunity to, and perhaps many of you already do. So in that, I will now just, it's good to start off the conversation, in my opinion, about what are the pillars of alcohol regulation. And first and foremost, it's to protect public health and safety. And it's very important to keep that at the forefront. And it can get lost in the conversation as we hear debates in our state related to alcohol regulation. But that is why regulation exists, because there is a recognition that this is a product that does cause harm and it needs to be regulated. So that is important to keep at the top of our mindset as we work through this presentation, but also to ensure efficient tax revenue collection. So, in this country, because we have the 3-tier system, the producers, the wholesalers, and the retailers, at the wholesale tier, that middle tier, that's where near 100% alcohol tax collection happens. Not every country can say that. So it's I overheard as I joined earlier, someone was talking about, the legalization of cannabis. And part of the argument in that debate is, well, we could at least tax it. And well, if you're going to go down that path, you better have a way to make sure you can efficiently collect those taxes that are owed. And we'll talk about that a little bit later in a current kind of policy debate happening across the country and how that's kind of challenged at the moment. And so the third piece and pillar of alcohol regulation is eliminated unfair or illegal marketing practices. This was sort of rampant before federal prohibition was instituted, that there was really unfair sort of practices happening that was driving high rates of consumption and really high rates of public order issues. And so this was a big important aspect to alcohol regulation as we decided to, go past federal prohibition and give states the right to regulate alcohol through the 21st Amendment. Eliminating unfair and illegal marketing practices as a main charge for alcohol regulation is important, which is also why it's important to monitor the licensee community to make sure that there isn't unfair and illegal marketing practices occurring. And then finally, balancing all of these interests. So that is a really, you can imagine, a big challenge. How do you make sure that these economic engines in some states, in terms of the retail and wholesale and producer tiers, are able to operate because it is a legal product, but then also at the same time, how do you make sure that you ensure that the public is safe with the sale of the product? So it is no easy task, but it is an important part of what alcohol regulators have to consider as they think about their totality of their charge, is that balancing those interests. So today we're going to talk about how do you infuse public prevention, public health and prevention narrative into that conversation to help balance the narrative. So a little bit about your structure. To know how to engage in the alcohol policy discussions in your state, you first have to know what is your structure and how is it set up. And so Iowa, as I've noted before, is a control state, meaning the state sells the product either at wholesale or retail. In the case of Iowa, it's at wholesale, and it's spirits specifically. Now, in some of these other jurisdictions you see that are gray, they might wholesale beer and wine. In some cases, they have retail stores, but in Iowa specifically, you wholesale spirits. So that's just very helpful to know, but also the Iowa ABD is responsible for regulating and licensing and ensuring compliance among the licensee community. So it's a large task that they have, and the control element of selling the product is one aspect of their kind of charge. And the idea behind the control model, just to spend a minute here, was states that adopted this model did so because they were attempting to remove the profit-seeking motive that was driving the agenda prior to federal prohibition. So some states decided that in order to remove that profit-seeking motive, they were going to take control over the sale of the product. And primarily states take that control at the spirits level because part of the main charge at the repeal of federal prohibition was to try to reduce and limit the consumption of higher ABV products. So that's why you see more restrictions around spirits, and also why the one commonality that all control jurisdictions have is that they wholesale spirits. So that was an intentional approach to try to mitigate the consumption of those products. So the unique thing of a control jurisdiction, and I think it's something that in control jurisdictions might, one, not be very publicly well known, but also in licensed states, they don't have this sort of value, not value, but benefit, I would say. So when the state is in the business of selling the product, they also are producing revenue that goes back into the state's infrastructure. So of course, here you see that a large chunk of those revenues go to the general fund, again, to support probably a number of services in the state. But also it goes to cities and counties. It goes to the Department of Public Health. It goes to support substance abuse prevention education programs. Now, I'm sure on this call, I'm preaching to the choir. You probably know this information, but the general public doesn't. And it's one of the values of having a control model. And it's often not something prevention thinks to talk about loud and proudly, but it is a tremendous value that you have in your state. And it also helps support and fund regular enforcement around the compliance and enforcement of the licensee community, which is important, again, to make sure that addressing those perhaps unfair marketing practices that may be happening, you can regulate that environment. So I wanted to spend just a minute of time, to talk about that, because I have found as I work across the country in primarily controlled jurisdictions that I share this with national audiences as well, because in my home state in Nebraska, they are not a control state. And so those profits that are made from the sale of the product go, to the private entities, and that's just how they're structured. But in Iowa, some of these profits go back to your state to support the infrastructure and also to support prevention and public health. So I will get off my soapbox on that, and we'll move on. But just note that is an important value that you have in your state. So why spirits? Why? I alluded to this earlier in terms of what was happening prior to federal prohibition, but what is happening today in relation to spirits? And spirits consumption is on the rise. We'll talk about that in a bit. But here you can see a study of, in 2000, the U.S. National Survey, the heaviest 10% of drinkers drink 55% of the alcohol reported, and 63% of that was spirits. So that's just an important fact about the heavy consumers are choosing spirits, and spirits correlation and linkage to higher to risks of traffic crashes, homicides, and suicides. There is a higher population level risk to those outcomes, those harms, as it relates to spirits. So there is some uniqueness to spirits that is still present today. And universities and college campuses and interfraternal council has taken note of that just by their own sort of experience with the product, that there are universities that have banned hard liquor, and there are the interfraternal council as well as other universities have decided to ban higher ABV products. So, this is more anecdotal type of information, but still I think compelling to talk about why spirits are different and unique, and why that's important again for folks to understand. That is how we regulate alcohol, by beverage category, by beverage type. And there are different rules and regulations for these different product categories. So to understand their uniqueness, and perhaps the uniqueness in terms of harms, is important to unpack. So alcohol regulation impacts all 4 Ps of marketing: price, product, place, promotion. And in relation to price, from a control jurisdiction perspective, you have a unique opportunity to set the price floor, which I know the Iowa ABD was attempting to do on a subset of products. And that's a mechanism to try to mitigate harm and reduce consumption on certain product types. That's a policy lever that you have in your state. You also have the opportunity to list and delist products at the regulatory level, whereas in Nebraska, you have to legislate that. If you say you wanted to ban alcoholic energy drinks as an example, that is something you would have to do through the legislative process. You couldn't do it at your regulatory level. Whereas it's my understanding, at least in control jurisdiction, you could do that. Now, whether jurisdictions do that is another question, but there's an opportunity to do it. Place. So in a control jurisdiction specifically, especially those that have retail outlets, they're able to place outlets not just by where the most people live, or where the market dictates, but also make sure that there's sort of equal distribution across the state, so that urban centers aren't saturated and more rural settings don't have any, that there's more equal distribution of retail outlets. When in the state of Iowa, of course, you have the private sector oversees the retail arm, and so the market is driving where those locations are at least applied to be. And then, of course, my understanding is you have local licensing and state licensing that have an opportunity to weigh in on where, in fact, those should be. And then finally, promotion. So because of our First Amendment rights in the state, or country rather, we have fewer sort of regulations around advertising related to alcohol, but there are opportunities from certainly retail signage and billboard signage to create regulations around those types of things. Certainly at the state level, but it also oftentimes at the local level through zoning, there's some opportunities to do that. And I know, having talked at great length with the Iowa ABD, which is our member, they work very closely with local jurisdictions about how they want to shape their how local jurisdictions want to shape this sort of 4 Ps. And now I see my screen again, and I don't want to. There we go. Okay. So the pathway to policy changes are happening at all branches of government. And I'm sorry if you're seeing that. Do you guys still see my screen?
No.
No, the screen went away.
I don't know why that happened, but let's try it one more time. Sorry about that, guys. We're getting there. There we go. Okay. Are you seeing pathways to policy change?
Yep, back now.
Great, thank you.
Yes, thank you.
Yes, so you might think about this more from the legislative end of things in terms of where laws are created, but we have, as of recently with COVID and the pandemic, we've seen executive orders really shape what policies related to what businesses can remain open, many of which were alcohol selling locations, and what type of operations they can do in terms of outdoor seating, because you can't, for retail restaurants especially, they've not been able to have inside seating, and whether you permit cocktails to go and things of that nature. That has been at least initially initiated by the executive branch. And of course, that's where your Iowa ABD is located, is under the executive branch. So there's rulemaking and opportunities there as well to change policies. And then of course the judicial, which I want to spend just a minute to unpack a little bit, because the US Supreme Court has been weighing in on these issues, and it's changing the shape and the way we have alcohol sold across the country. So in the most recent case in June 2019, the US Supreme Court ruled on a case that was related in Tennessee, but it had rippling effects across the country. And it was specific to residential requirements for licensure. And what they basically said was the case in Tennessee, that it was really protectionism over public health and safety protections, this particular way in which the law was written, and that, you know, it put the residential requirements to have a license in question. And it didn't say you couldn't have them. It just said that you have to show and substantiate why you have them and why they protect public health and safety. And of course, one of the rationales for residential requirements is, of course, that the person who's selling this product in your community knows your community, understands the community and social norms, is vested in it in terms of the harms that might be happening. And so that's the idea of residential requirements, but you can't just say it's for public health and safety, you have to prove it. And that's essentially what the courts ruled. But what that did was, for many states, they began to remove those residential requirements to licensure because they didn't fully understand the full scope of that decision. And ultimately, when you remove that, that kind of opens it up for retailers to be anywhere. And if you will permit direct shipping and home delivery of alcohol, then it could be your license number could go quite high, because the potential is that, you know, places across the country could be selling into the state of Iowa. So these have really big implications for how alcohol is sold and regulated across the country, that are decisions being made at the judicial and executive and the legislative. So how do you balance the alcohol policy debates in your state? And because it is a very fast moving area of policy, and especially now with COVID, it is even faster moving, it could be difficult to kind of keep your finger on the pulse. And we monitor this stuff across the country, so always consider us a resource to help you monitor these kind of things happening in your state. But the first thing you need to do is collect data and know the science at a base, and also know what is happening in your state in terms of your structure and where the power is at any given moment in those decisions being debated. And then finding authentic messengers, and we're going to talk through all of these, but finding those authentic messengers, monitoring current issues, and then education and awareness. So let's first dive into collecting data. Alcohol environment is a wide and vast area, and fortunately for us, we have some data from the experts from the NIAAA. It was a funded project to NIAAA that looked at alcohol policies across every state, and in these 4 primary domains: enforcement, countermeasures, regulatory oversight, limits on place, product and price, and promotional restrictions. Assessing, do you have these policies, and then are they enforced? And gave every state a score. And those scores, they found that the higher APS score, the more safeguards you have in place, the fewer harms you have in relation to binge drinking, homicide, victimization, and cirrhosis, mortality. And so in Iowa, your alcohol policy environment, you have fewer safeguards, according to this research. And you're in the left-hand column of the spectrum here in terms of, again, safeguards you have in place. So, from a prevention and public health perspective, there's some opportunities here to improve the score.
Kathy,
yes.
I just want to, I hope everybody's seeing this slide, because I think we need this slide. And as there you go, get a break, drink of water, we're here. But this is really something. I just hope you all see this slide, because this is something I know you can't see it if you're on the phone, so I'm sorry. But anyway, we will get this slide for you all to see. And anyway, we'll get your presentation, but I think this would be a good one to snip and put into some emails or something, some letters or something, for a picture. Thank you.
Yes, you're welcome. You're welcome. Yeah, feel free to interject anytime, Jennifer. I'm happy to have this be more conversational than just me talking at everybody. So the same group of researchers looked back over time to see how these scores have changed. And what they found is most states did improve their alcohol policy score. So that's the good news. But if you unpack those policy improvements, it's been primarily around impaired driving and around underage drinking, but not around adult excessive alcohol consumption. And as we talk about later, you'll see why that might be more important to start bring to the forefront. But that's an important distinction, that there's this understanding that impaired driving is harmful and that underage drinking should not happen, but there isn't that same kind of consensus at this point across the country on excessive alcohol consumption in adults causes problems, and we need to figure out ways to mitigate that kind of consumption. So when you look at Iowa specifically, you have improved your alcohol policy score in the last 20 years, 25% increase, and we just kind of pulled a couple states to kind of give you a regional look at that. So that's also important to note, but again, thinking about what kind of buckets those improvements have happened are important as well. So also what you want to be armed with are just trends in alcohol use. And generally, I'm going to just quickly talk that, consumption is on the rise for women, older adults, racial, ethnic minorities, and socioeconomically disadvantaged. ER room visits related to alcohol have risen 62%. So these are pretty significant numbers across the country. We are seeing an uptick. And then alcohol-related deaths have doubled. And that is true in Iowa. And in fact, that's why you have the Iowa Department of Public Health pulling in a stakeholder group on this topic, because in the 65 plus, you've seen a doubling of alcohol-related deaths in the last 10 years, specifically in the 65 plus. So looking now by age group, as I noted already, you can see here in orange is 2011 and in blue is 2018. Over in the age groups 18 to 24 all the way up to 65 plus, that's what you're seeing. Regular alcohol use, this is Burfus data, and regular alcohol use means you've had a drink in the past month. So here you can see that fewer people ages 18 to 64 in Iowa reported drinking alcohol in 2018 compared to 2011. But that is the opposite story when you look at ages 65 plus. Those numbers are going up over time. And when you look at the orange, and the orange color here now is national figures and the blue is Iowa. And again, still looking at 2011 to 2018 comparison. So at the national level and in Iowa, there has been a decrease in binge drinking within the 18 to 24 age group when comparing the rates in 2011 to 2018. Probably not completely new information for folks on this call. But in the older age groups, starting at age 25, although not huge uptick, but there is increasing. This is increasing in Iowa as it is also across the country. But I think when you look at frequency, okay, so 15 binge drinking more than 15 days in the past month. So frequency in which you're drinking and your it's drinkers, excuse me. You can see that in Iowa, the age group with the highest percentage of heavy or frequent drinkers is the 65 and older age group. And again, also true across the country, but it's notable to be armed with these kind of facts when you're thinking about the different policy debates going on in states. These are important data to be able to unpack in terms of who's drinking heavily, who's drinking frequently, and why maybe only focusing on underage drinking, for example, isn't sort of the best bang for your buck, if you will, and why adult consumption does need to be looked at because of what you're seeing right there locally. And so to Iowa Department of Public Health's credit, they are looking at this, and I think that's just wonderful and a wonderful opportunity to heighten this conversation in the state. So also you want to know, what are people drinking? So I know this group knows very well that beer reigns supreme in the state of Iowa, and you can see that very clearly in this in this chart. Per capita consumption for beer is much higher than any other beverage category. But what you can see from basically 2009 is that consumption, per capita consumption for beer is declining. But in the other beverage categories, it is increasing, and most prominently in spirits. Again, a trend we're seeing across the country, but these are important conversations to better these are important data to understand, because this is how we regulate alcohol by beverage category. So your outlet density. These are numbers just I quickly pulled from the Iowa ABD website of number of active alcohol outlets per county. This is a cursory way to look at outlet density, but also very important to one, just kind of have a snapshot of where are you seeing sort of the densest number of outlets, because certainly we know from the literature and CDC that the more outlets you have tends to lead to more consumption and more harm. But there's a lot of ways you can unpack that narrative, and knowing what's happening in your local community is very important. So this is a helpful national perspective, but what's going on in Polk County, for example, you would want to drill down much more granular than where we are right now. And then looking at it from on-premise locations, restaurants, bars where you can consume on the premise, here are your sort of density numbers by county, and off-premise, your density by county. And I hope I'm right in saying this, but my colleague who pulled some of these numbers for me referenced that she thinks it's the only state she's seen that a laundromat was licensed. Now, I don't know if I haven't validated that myself, so I'd be curious to know if anybody on the call knows about that specifically. But, these are, it's just interesting to see how these kind of licensing decisions are made in states, and localities have a pretty significant say in Iowa in terms of what is licensed.
Hey, Cassie. Hey,
yes,
guys, I'm gonna give you a break. Okay.
Yeah.
Back up that slide a second. So I don't know if I'm having a little trouble seeing my own county's numbers, because the count that you've got a lot of the rural counties in lighter color, so it's kind of hard to tell between them. But anyway, when you get that slide, we'll get it so we can read it, because this is really interesting information. And I almost feel like I remember about the laundromat place, but I'm not sure if it's true. If it wouldn't be Blackhawk County, would it?
I'm not sure. I
thought maybe Jackie or them on the call might know, but I didn't know if it was near you and I or something. But I don't know. Maybe not. I'm probably mixing up. Maybe it wasn't Buds and Suds. It was Duds and Suds or something. I just remember that. Anyway, that would be even the marijuana. That's all. Like, I was thinking Bud, not Buds. Anyway, this is interesting. This is definitely where we want to go. We need this information. Thank you. Jackie says I'm right. Yeah. I thought so. Okay, awesome. I mean, not awesome, but I'm glad I'm right. But anyway.
Yeah. Always nice to be right.
Yeah.
Alrighty. Thanks, Jennifer. So then here you look at all licensed by type, by convenience store, restaurant, bar, tavern, grocery store, etc. on down the list. Oh, actually, excuse me. There's the laundromat, number one at the bottom of the list. There is one in the state. And this just helps contextualize what's happening in terms of, places that are licensed. And I can tell you that sometimes in prevention, you think about, the industry as it's sort of this monolithic, all kind of one type of industry, but it is a very diverse industry. And so, a lot of things that are sort of driving changes in legislatures are actually coming from, Walmarts and Costco's, big box stores, grocery chain stores. These are really important to understand sort of all those nuances. I can tell you in Baltimore City, for example, where I've worked on outlet density stuff before, and, package store associations have been helpful prevention allies, because they also don't want more competition. Now, they are coming to the table for different reasons in terms of why they're in that debate of not wanting more outlet density. You're coming at it from what you know in the science, but that doesn't mean that your end goal, which is you didn't want more outlets, doesn't impact, doesn't align. And so it's just important to see how things are taking shape and the types of outlets you have in your state, and also how they're engaging in these policy debates as well. And I talked a bit about Baltimore, but this is just an example of taking outlet density data and making it more powerful. and more localized. So these are two little neighborhoods in Baltimore City. Roland Park, you can tell just by the demographics, is a more affluent area of the city with a very high median income. And you can see that life expectancy, 83 years of life, a violent crime rate is low, despite what you hear about Baltimore City in this particular area, very low, and the demographic makeup of the population. And you see here that there's 0.3 outlets per 1,000 people. Switching gears to Greenmount East, which is in West Baltimore, or actually no, it's in East Baltimore, hence Greenmount East. And you can see here that the median income is quite a bit lower, $23,000 on average, 23.6, and the households below the poverty line, 26%. The demographic of the population there, and then the violent crime rate is quite high, and the life expectancy is nearly 20 years difference from the other area of the city. And talk about, from an equity lens, this is a very powerful conversation way to kind of unpack that data that we were just looking at a very high level and maybe distill it down to the neighborhood level if you have that ability, or even county comparisons could be helpful. And so here you can see in this particular area, they have 1.6 outlets per 1,000 people. So really, you're not just talking about equity, you're painting the picture about equity. This is bringing the data to life and making people feel it. That's what prevention's charge is, of how you unpack these types of things. And CDC has a number of resources to help communities do this. Part of that is measuring outlet density and using different techniques. These are technical things. You need an epidemiologist, somebody who has geospatial analysis skills, somebody who can not just to map the outlets, but also help you. I mean, in that case in Baltimore, just to go back quickly, this is just looking at the outlets and the density. That's fairly simple way to dissect this information. But when you are trying to understand the relationship between outlets and harms in your community, now you're getting into a much more technical skill. It's doable. It does take some expertise. Your health department perhaps could help you, and CDC is there as a resource, and they want people to, in fact, they hire a consultant to help states do this. So tap into that resource and can connect you to them to get that done in Iowa. So it would be interesting to see. Somebody had a question and I didn't get a chance to read it. Jennifer, can you, I don't know if it's a question or just a comment, but it might be worth reading it.
Well, Kristen, Frank, we have a couple here, but it would be interesting to see the outlet density and equity here in Iowa, especially with our higher population counties. It'd be interesting to see it everywhere. Yeah.
And I didn't break down your consumption data by income, but just generally, I can tell you that what you see typically across the country in terms of who is drinking a lot heavily, it is more affluent, people who have household incomes of $75,000 or more a year. So this is a bit counter to other substances in terms of who is consuming heavily and how that takes shape in your policy conversations and people's willingness to hear these kind of information, because a lot of times people, policymakers, decision makers are included in this. We all are. We see the issues through our own lens, our own experience. So it can, when you just take all this kind of information and unpack it in powerful ways, like I just demonstrated, it can help break through that personal lens and see the data and feel the data. So public opinion is on prevention, public health side, I would say. This is a study, and I see this as really, the source is grayed out, but I need to correct that on this slide. But source is Public Opinion Strategies from 2019. And the question is, which concerns should lawmakers consider when setting alcohol regulations? And the response is very important. And so here you can see on the left side that people want policymakers to think about reducing drunk driving, protecting health and public safety, and reducing underage drinking. And they're less concerned on the right side with allowing more businesses to produce and sell alcoholic products, lowering price for alcohol, and giving consumers more choices. That's not as concerning as these other pieces on the left-hand side of the chart. And this can help you when you're having these conversations. But part of it is, I think, in prevention public health, and I have seen this for now, over the 15 years I've been doing this work, we're really good at talking to each other about this information. We're not always as good about talking to policymakers. And so when they're in these moments and they're only hearing from stakeholders who have an economic stake, and they're not hearing from public health and prevention, it can be an imbalanced conversation. And they're seeing a myriad of policies on any given day. So it is prevention and public health policy folks' charge to bring these data, these things to the forefront, because the general public is wanting lawmakers to consider these things in these discussions, and not just lawmakers, but policymakers too, from the ABD there in Iowa to certainly zoning boards have a role to play. So there's a number of decision points that happen as it relates to alcohol outlets. So knowing the science, what works, is also really important. And here are strategies that the CDC has identified that are known to be effective ways to prevent excessive alcohol use. Now, these are all very high-level policies, enforcing underage drinking laws, enacting dram shop liability and protecting dram shop liability from being eroded, limiting outlet density, which we talked quite a bit about, increasing alcohol taxes, but there are other policy levers related to price that they didn't dissect but are showing promise. Limited days and hours of sale, so not expanding those hours and days, and then preventing privatization of government control. So because the state of Iowa is in the business of selling the product at wholesale, CDC says you'd want to maintain that. You would not want to erode that policy. But all of these policies are very big policies. Most of these debates happening in states are happening at much more granular level than these big ideas of policy. But generally speaking, this is where CDC says, we have the science to say these are important policies, you should have them in place. So how do you take all that data that now you understand the landscape, you have really powerful data, and yet at the same time you need authentic messengers? How do you find those authentic messengers? And I would argue your data should guide you to these new stakeholders, that you have an opportunity to when you see that your 65 plus age group is having heavy consumption, it's on the rise, and their alcohol related deaths are on the rise, perhaps AARP could be of value to your kind of network. We have to look beyond the 12 sectors that our grant requires us to have around the table. And I know I experienced this myself. I had people who would come to my table who were there for their JOB, and that was it, nothing more. And they were not going to be rolling up their sleeves to do a little bit extra. And I'm not saying that's always the case, but certainly I'm guessing others, I can't be the only one out there who has had that experience doing coalition work. And if somebody who has a charge and a mission to serve, like I said, the 65 plus age group, for example, you're meeting them where their self-interest is, because they have a mission to work with that age group and make sure they're prosperous and that their life is going well. And meanwhile, alcohol is impacting that. And now you've just met them where they're at, where their self-interest is for why they care about your issue, why they would care about this issue on alcohol. Another is, of course, law enforcement. Law enforcement can be in a difficult position to speak on these topics because politically it can be challenging, but their associations may be able to speak out on it. And recently, the National Liquor Law Enforcement Association, which is a membership organization for alcohol law enforcement, they spoke out through a membership advisory that they said, we know the pandemic's been difficult. We recognize there are major economic hardships, but we got to stay the course. We got to keep making sure we monitor this environment. When an association like that speaks out, and maybe your locals can't, you have a powerful voice that you can share with your decision makers that, you know what, this national group is calling for us to remember we still have to watch and monitor this environment because there's a recognition this product can cause harm. Another stakeholder, ER physicians. You know, ER admissions are on the rise. They can be a powerful voice, but guess what? As you know, I know, they're busy. So if you have a news conference where you're trying to bring light to that harm, you might have to help them with their talking points. Because at the end of the day, you know, they might be, I know one stakeholder in North Carolina who was able to recruit an ER physician to speak at a time on a specific policy that was really important in the state. And she just told her stories, and the prevention person just typed out her story and then packaged it into a testimonial that then she approved and ultimately then read at a news conference. There's ways you can help a really busy person who maybe can't come put their feet under your table at your coalition meeting every month or every other month or virtually join you as we do now. But they have such important information to share, and it's that authentic voice, that storytelling that brings the data to life. And so, yes, youth are important and they can be a difficult voice to harness and get engaged, and parents, of course, but like it's important to think about all these other touch points that you have an opportunity to bring that would stop a decision maker in their tracks and say, I haven't heard that person speak on this topic. And recently, I even saw that in Iowa, suicide rates are on the rise. Well, in Ohio, the Suicide Prevention Foundation is an active player in these conversations in Ohio. So maybe they are in Iowa too, I don't know. But I wanted to plant some seeds about thinking about your stakeholders and who you have, not just at your table, but beyond the table, and thinking about that particular angle of that current policy debate that might be happening, and who could you bring to the table with that authentic voice and that powerful story. So monitoring these current issues is so important. And I just took a sampling after doing a quick Google search of what's going on in Iowa. So here were a couple headlines that I found. Iowa liquor sales surge in pandemic. Now, this is not unique to Iowa. This is happening across the country, but everybody is under a lot of stress, Grocer says. The next, coronavirus causing spike in relapse for drug and alcohol abuse in Quake City Coalition's weekly COVID-19 briefing. Citing coronavirus's effects on businesses, regulators back off major price increase for liquor in Iowa. Iowa legislation allows restaurants to continue selling to-go alcoholic drinks. Now, as Jennifer noted earlier, this sits at the governor's desk. These are just a couple samplings of articles that I saw just through a quick Google search. And so I'm hoping that certainly AC4C and others are monitoring the media, because they can be a really, it can be a great way to keep your finger on the pulse of what's happening at these different touch points in terms of where decisions are being made. But then these are also opportunities for media, op-eds, letters to the editor, to infuse those powerful data that we just talked about in this narrative. Because public health and prevention have a rightful place at the table. You have a rightful place in these conversations, and you shouldn't wait for people to come to you for them. You should be infusing it in these conversations. So another current issue is get the door, it's the liquor store, home delivery of alcohol. Quick basics, direct shipping. Producer goes through common carriers like FedEx and UPS, directly to the consumer. It takes the wholesaler and the retailer out of the equation, just directly from producer to the consumer through direct shipping. Home delivery through third-party food vendors and online platforms like Drizzly, or retailer to the home. You know, they're delivering it themselves. Producer, wholesaler, retailer. This is still intact, but you have a number of players that are getting it from the retailer to the consumer. This is home delivery alcohol, what it looks like in states. So direct shipping in Iowa is permitted, and it is for wine only as of 17. So if anybody on this call knows something different, please weigh in, because this is data from the Stop Act report to Congress. So I could be out of date. 2017 was a while ago. This is still correct. Thank you, Denise. And then if you look at home delivery permitted, this is just retailer to the consumer. This is not taking into account the third-party delivery folks. So that's not an area SAMHSA has looked at yet. Hopefully in their future reports they will. But in the state of Iowa, home delivery from retailer to consumer is permitted for beer, wine, and spirits. Third party is not allowed in Iowa currently. Oh, right. Thank you, Denise, for weighing in. This is so helpful. Because there is an opportunity for prevention to weigh in on that conversation, that you don't have that yet in the state of Iowa, whereas in many states that has already happened. So just planting that seed here. And of course, we know with COVID, there have been a number of various opportunities for changing the way alcohol is sold in the state because of not allowing on-premise and social distancing requirements and things of that nature. And there's a way to do this where you still help, you still help the licensee community, but it's temporary. And that it sunsets. It's not a permanent change. So what you have that just worked its way through the legislature for drinks, cocktails to go, that is a permanent change the way I read the bill. That does not end with this pandemic. And as Jennifer noted, it is sitting with the governor right now. So education and awareness. Education and awareness. And this is where sometimes in prevention and public health, we all get a little uncomfortable because we're very comfortable with education awareness. But then when we think about talking to a policymaker, we get very cautious, as you should, because there are restrictions to your funding and how you do that. Which brings me back to why those authentic messengers are so important, because there are a lot of times you get those 12 sectors at your table, and they are people who are there for their job, and they can never speak on these things. And that does not help you, because you need to be able to bring awareness to the data, the science, what you know as experts, to balance these conversations, which requires you to have more folks not at your table necessarily, but at your disposal, who you're nurturing along to help bring that authentic voice and authentic story. And media advocacy can be a powerful tool to stimulate, broad-based coverage, reframe and shape public discussion, and increase support for and advance good policies. So media advocacy is the strategic use of the media. So all those headlines we just reviewed, there's an opportunity for media advocacy to bring the data to life, to bring what we know about policies that are known to be protective. That's media provides you that opportunity to raise and infuse the conversation. It allows you to set the agenda, to tell the public what specific issues are important, and ultimately how people should think about these issues, to bring in another part of the story, which is it's not just about economics in terms of what retailers and other industry stakeholders are bringing to the table. That is part of the story. They have a right to sell the product. It is a legal product. However, it needs to be regulated, right? Because we know it causes harm. And it's your job in prevention and public health to tell that part of the story. So I like to think about Kingdon string theory to talk about how to open policy windows and set agendas in the policy debates. And Kingdon's stream theory is you have a problem stream, you have a policy stream, and you have this politics stream. And when those streams come together, whether you force them together or whether they come together organically, a policy window opens and the agenda is set. So I'm going to walk through a case study of a case in Maryland that I'm intimately familiar with, where they opened the policy window by looking, opportunity with preparation and a little bit of luck. They got some they really got the prevention message through. So we'll start out with the situation, and it was craft brewing in Maryland. And the comptroller, again, back to structures in states are important. The comptroller, an elected official in the state of Maryland, is the chief alcohol regulator in the state. And he oversees licensing for producers, and for wholesalers. And then they have local liquor boards in all 25 counties. They are responsible for retail licensing. But he oversees sort of all of it, the whole kit and caboodle, and certainly tax collection. So he saw the craft brewery opportunity for growth in the state. And these were some of the things he was saying. You know, current laws and regulations pose an existential threat to the industry's future growth in Maryland, and with it, the jobs, economic activity, tax revenue, and tourism opportunities generated by this community of innovators and entrepreneurs. In the absence of comprehensive reform, Maryland's reputation within the national craft brewing industry will continue to suffer, and the economies of our neighboring states will benefit at our expense. Maryland's beer laws are antiquated, dysfunctional, anti-small business, and anti-consumer. Wow, powerful messaging. Very much speaking about values that we care about, and it goes right to sort of the heart of the matter from an economic standpoint. He said out loud, I do not see this as a public health issue, later on in the debate. So he went on, because of how he felt about that, and the opportunity he saw was there and not tapped into, he created a task force called Reform on Tap. It was a 40-person task force comprised of industry stakeholders only. There was not a public health person, not a public safety person, only 2 senators on the committee. Otherwise, it was all industry stakeholders. So we have, again, mostly the economic side of the conversation at the table. They held public meetings, but there was no opportunity for public comment. It just, you could go and attend these meetings, and they were held at breweries throughout the state. They ultimately came up with what they called a 12-pack of recommendations that would later be turned into a bill. And they called this whole initiative Reform on Tap, a world without limits.
Oh my.
So the Maryland Public Health Association watched all this the entire year. They attended some of those meetings just to observe. And they just sat silently waiting for their opportunity to bring the public health perspective to the table. And when that 12-pack of recommendations was introduced a few days before Thanksgiving, they were ready with an op-ed. And they took this data. Alcohol-related deaths in Maryland have been steadily rising since 2010, nearly doubling between 15 and 16. The economic burden of $5 billion in 2010 is substantial. State collects $310 million in taxes. So the tax is not paying for the economic burden. Only 51% of Marylanders drink in the past month. So in terms of current drinkers, you're really narrowing in on only a subset of the population. Certainly not. There's 50% who weren't drinking in the past month. They focused on increased availability, how it increases consumption, and increased negative outcomes. And they had an op-ed. See the date, November 29th, 2017, days after this release of the task force. They were ready. They had their data. They saw this coming, and they were ready to infuse the conversation, to balance it with the public health case, because there was a public health case to be made on this topic. So they, because of this op-ed, it opened the door for them to be invited by the chairman of the Economic Matters Committee, the committee that was going to hear this bill, and here's all alcohol bills. They also were invited to then, newspapers can drive other media sources and their coverage. So they were invited to interview on a local radio show that a lot of legislators listen to. And this is just noting here that the committee that they were invited to come in and testify and speak to, ultimately it's the committee that sees all these bills. So they were having a moment in time where they were able to educate this committee, where they're making big decisions for the state. So what happened was they supported, so ultimately that bill was not successful. The Reform on Tap package, 12-pack of recommendations, was not successful. And because legislators were very frustrated that there wasn't an understanding of public health and safety from the comptroller, who was the chief alcohol regulator in the state. They were sort of in a bit of an infight. Of course, public health didn't know that. They learned it over time, but it did help their cause in the end. And so ultimately, legislators on that committee created a bill to create a new task force to study alcohol laws for health. And then Public Health Association had a seat at that table, which was half public health prevention, public safety, half industry stakeholders, which is good because then legislators could hear all aspects of this issue. And they made public health recommendations through this package of recommendations that turned into its own bill. And they organized stakeholders to testify. So it wasn't just the Maryland Public Health Association going to testify in that moment. They organized a whole bunch of stakeholders to show the diversity across the state of people who cared about these issues. That was important. And they all couldn't be there in person to testify, but the Maryland Public Health Association read off all those different associations and individuals who were supporting their cause. Ultimately, this bill removed the comptroller from his alcohol regulatory role because they recognized he didn't fully get the broader scope of not just economic aspects, but the public health and safety. It established a new 5-member alcohol tobacco commission with representation from public health, public safety as well. And the commission is now charged with creating best practices for 25 liquor boards across the state to bring some level of uniformity and guidance. And part of that is, law enforcement needs to report to liquor boards about cases that happen in and around outlets, for example. That's just one way to begin streamlining and kind of cleaning up the way things are done in the state of Maryland so that there's a better understanding of what's happening in terms of alcohol's relation to harm. Now, this is what the public hearing looked like. There were 70 breweries that came to testify on that original bill, that 12-pack of recommendations way back in this was 2018. There were the public health people, 2 of them. But again, remember, they came with a lot of testimony from other people who just couldn't physically be present. But nonetheless, this is often what it looks like in a legislative hearing. Anybody who's been to them understands that usually public health and prevention are not out in droves. And this was what it looked like also in comparison. The economic narrative was out in force and very powerful in that moment. And this can be intimidating for a lot of people. And so I recognize that can be intimidating, but it was powerful. It was needed in that moment to give legislators in Maryland who wanted to move the public health and prevention, they wanted to make sure that they were protecting public health and safety, but they needed public health and to raise the data, to share the information, bring those authentic voices to the table, and help them shape that conversation in this committee to show there is other sides to this story. What worked for them? Generating media advocacy was absolutely paramount. Organizing their likely and unlikely partners. Beer wholesalers, for example, were an unlikely partner that they found in this conversation because they had skin in the game too, to potentially lose. Again, they came to the table for different reasons, but the outcome was the same. They were concerned with, a world without limits, reform on tap. Framing and messaging to resonate with policymakers, using data to build evidence to explain the outcomes, and being flexible and prepared and look for those opportunities as that new bill emerged, the new task force happened, they had an opportunity to sit at that table and they were ready and prepared to do so. Whoopsie. But the other thing that was at play here, and this is that political stream that Kingdon's theory talks about, and that is that there was some major infighting going on in the state of Maryland between Democrats in the legislature. I apologize for the sirens, if you can hear them. The legislators in Democrats in the legislature. Maryland is a primarily Democratic state. Probably you all know this, but the legislature Democrats were, and the comptroller is a Democrat, and they are at odds frequently. And so when the comptroller here pictured Peter Francho was moving this agenda forward on alcohol, his reform on tap bill, he, the Take a Hike Mike was the Speaker of the House. And also Democrat. This picture just shows you the infighting that was going on in the backdrop. And while the Public Health Association did not know that, and they were just sharing their data and they were framing it in a way that was very helpful, they did stumble on this political infighting that they just could not have predicted. But this helped them give sort of political cover to legislators who didn't like this bill, and maybe they didn't like it because of the comptroller, who knows, right? We don't know, I can only suspect. But the point is that they gave legitimacy and powerful rationale for why you should move with caution into this area. And they stumbled upon this kind of messy political dynamic that's always going on in different states, taking shape in different ways, but you should know it. You should be aware of it. And in this case, this dynamic helped the public health case, but other times it may not. And so it's always helpful to have your finger on the pulse of that political stream as well. So in your state right now, where are you in terms of current policies? So as I noted earlier, the Iowa ABD did have a new proposed price floor for some distilled spirits. But that's been halted for now because of the current economic situation. It did seem to me by reading the one article that it is still on the table for the future, perhaps. So that's something to be aware of, be prepared for when that moment comes again. There's an opportunity, because that's a unique opportunity in Iowa that you have that ability to set a price floor for certain distilled spirits products. Which means you have to charge this much for that product. That's part of what that means. And Jennifer has a number of materials on that if folks are interested, because that alone could be its own webinar. Mixed drinks to go past legislature, as Jennifer noted earlier, and it now sits with the governor. So it's not a complete done deal until certainly she moves forward to sign it. And then the Iowa Public Health Department has an alcohol-related death outcomes or work group, and that will produce a report with recommendations, and that will create opportunities to begin to infuse the public health narrative, to take those recommendations and start talking to key decision makers about how to move public health and safety forward in the context of the economic dynamics that are always present and there. And again, that this is a product that is legal, so it can be sold, but this is where it's important to also have that balance. And so balancing the narrative and alcohol policies, bringing it back home here, tipping the scale with local data, science, powerful stories told by authentic messengers. That is hopefully through this, you've been able to gather some just tidbits, some new information, maybe some new data, new ways to look at the data, tell the story, to kind of help bring and balance this narrative that quite frankly needs to happen across the country, certainly not just in Iowa. So with that, I'm going to pass it back to you, Jennifer, and open it up for questions, comments. Iowa ABD, please speak up if you want to say a few words. You're more than welcome to. I appreciate that you're on. So with that, I'm going to pause.
Unmute yourself, guys, and go ahead and ask Cassie some questions. I know one thing that was up earlier that Jackie had put in here is there a more detailed scorecard, back when you were talking about the scorecards, that would easily translate to use with potential stakeholders, like where did they get that score kind of thing?
Yeah, so I would suggest reaching out to the researchers, the main researcher, which is Dr. Tim Namey and Jason Blanchette. They could tell you specifically what was reviewed for Iowa and how they came up with a score for Iowa. They don't unpack every state in the journal articles, so you would have to engage in a conversation with them specifically. And I can tell you, researchers would be just delighted if somebody reached out to them and said, ooh, can I get all your data so I can better understand how you came up with that number for Iowa, and looking at what it is today so you can see that change over time. That would be my recommendation.
Could you either in the chat or email me or something the name again, or
yep.
maybe if you have it sourced at the bottom of your PowerPoint, you're going to send us a PowerPoint, whatever, either way.
Okay.
Got it in here. All right. Anybody else? Just feel free to ask Kathy questions. I know we're just a little past what we had on the agenda, but we'll maybe 5 more minutes for questions, and you'll still have an hour and 15 minutes for lunch. Anybody want to just comment?
Yeah, Kathy, this is Peter from Partnership for Healthy Iowa.
Hi, Peter.
Oh, you can hear me okay, good. I mean, I love the stuff you're doing, and I love all the correlations, and I know that we need to get the elephant sort of in the room, for where the problem resides. But one of the long-term, I mean, obviously a long-term solution to this is make sure we make huge impact on youth use of alcohol. Because that's really the fuel to the fire 20, 30, 40, 50 years from now. And we know the stats support the fact that if you don't have early inception of youth alcohol use, I think it's by the age of 18, we have a huge reduction in lifetime alcohol use. So do you have much data that's doing some correlating so we can extrapolate youth prevention programming to long-term use in a way that it binds that to a centralized funding sort of landscape as well?
Well, as you would know, there's been a tremendous amount of progress on underage drinking rates across the country, and that has been in large part because of the intentionality from the Enforcing Underage Drinking Laws program that was, I'm sure you're quite familiar with, and that intentionality has really helped. Plus, the current generation coming up are just more health conscious, and so they're not tending to drink as much. So yes, that is a piece of the picture. Certainly, if you can prevent a young person from consuming before the legal drinking age, and certainly before, if they start drinking before age 15, they're more likely to be alcohol dependent. I know this crew knows those stats, but that is when you think about the harms and what we are presently experiencing, it's important not to detach from the adult consumption and what is happening, because when you look at the 88,000 alcohol attributable deaths in the country, 95% of those are of legal drinking age, 21 and over folks. So I'm not saying forget about underage drinking. That is important. And we have spent a ton of energy there in prevention for a long time. And we haven't made the jump. And I'm not saying this group, I'm sure you have, but many have not made the jump to talk about adult consumption. And it's a place that people are less comfortable with. But if you're in the business of trying to prevent harm related to alcohol and substances, then you have to look at the adults and the harms that they're experiencing as well as young people. I'm not saying take any focus off young people, but it cannot be the only place. And I'm not saying you're suggesting that, but I think it's important. You brought it up. I want to say it out loud that we think about.
Well, and I think.
No, I think. Yeah.
Sorry. Go ahead. Well, Peter, I was just going to say, I thought of what Cassie was talking. When we mentioned like the different stakeholders, like AARP, and these are our grandparents. These are our parents. These are when you lose, when you have people with substance use issues in your life, it affects children, and in maybe different ways, like we all know with ACEs and different things. So I think we can look at it that direction as well. And anyway, that was just my thought is when we were thinking of stakeholders is we all care about, and we know how important it is for, parents and grandparents to be positively involved in their children's lives. Go ahead, Peter.
Oh, Kathy, I completely agree. The point I'm trying to make, though, is that I hope that we can always keep correlating those gains in youth with the future outcomes in an elderly population. Because we did a snapshot today and extrapolate into the future, we'd probably have less of the problem with an adult population. And what we have seen in Iowa is if you give an inch, they take a mile. If they think we've done enough, whether it's opioids or meth, all of a sudden the funding goes away and they go jump on the next silo of interest. And if we don't keep a strong correlation between underage drinking and that investment as a long-term solution, along with the mid and the short-term solutions of dealing with the age of population where the most use is, we will find a lack of interest in funding in legislation because that's the way they seem to go. when the problem seems to, oh, we've done a great job with marijuana, so that they don't have to worry about that. But they don't see the resurgence until it's too late, till I call it a body count, just like the opioid epidemic. We had tons of people screaming the opioids are a problem, and now we have a ton of people saying we've got it under control. Look at the numbers. Not so much. So, and then we have meth coming back because we stopped funding meth. So that's all I'm talking about, is that to see a strong correlation between the long-term investment by investing in children and the need to also put out those powerful surges in use that came from kids of generations that did not have the benefit of all of this education and prevention work, and in health in general.
Yep.
Otherwise, they'll diminish the funding, they'll diminish the interest, and before we know it, we'll have a resurgence again, and we'll be working on a 30-year-old problem when we had a 5-year solution.
Well, and I think like you think about even the fact that with this, we have such a change in environment. I'm afraid of some of the gains we made with those kids as they get to be older, and there's just so much more acceptance. I mean, we're still very influenced by our environment, even as adults. So, you know, it doesn't mean that you can't develop an alcohol issue when you are 40 years old for the first time in your life, even, you know, or 30 or 25, whatever. So I think it's important. And I want to read one comment from Denise here in your chat. Thanks, Cassie. Wonderful presentation. I have to jump off here, and she just did, Denise, but she'll be back tomorrow for our partner sharing. If anyone has additional questions, she's happy to chat tomorrow for our ABD. Anybody else have a question? I think it's 11:30. We really need to let Cassie go. But anybody else have a burning question before we leave? Let Cassie go and we all go to lunch.
Jennifer, not a question, but just a comment about like different partners. We've had really good luck working with Northeast Iowa Agency on Aging, and they do lunch and learns in community centers, libraries, their offices, and related to that issue with binge drinking with the older population. And with some presentations found like huge correlation, not only with the binge drinking, but then also with prescription drug misuse and the combination of the two. And yes. So that's really something that I think, you know, when you're not just focused on one thing, but you see those correlations, really take some additional work because they don't always put those things together, and not just prescription meds, but any meds, because we saw like a lot of over-the-counter kinds of problems, like with Benadryl, allergy medications, vitamins, all kinds of things, because it changes absorption. So, and with that link to binge drinking. So just kind of put that out there. There's some real potential with some different agencies that are doing a lot of outreach to the senior population.
And that's really what we need, our, you know, IDPH partners and the IPN, you know, to continue to help us, you know, with all these things. A lot of us are focused with drug-free community, of course, on youth, but okay,
Jennifer, this is Laurel. I know you're trying to get off the phone, sorry, or get off the meeting. But on that note, the WISE program is an evidence-based curriculum that that IPN has approved for the older adult population. It's a 6-week curriculum, and it addresses just what the last person was talking about, alcohol and prescription misuse. At the same time. So we're going to be using that at Heartland Family Service as well. And so I think stay tuned to information from IPN or from IDPH on training in that curriculum. So
yeah.
I can't promise that they're going to bring in trainers, but I think that might be the way they're leaning.
Hi, Laurel. It's Cassie. Nice to.
Hi, Cassie. I missed some of your talk. But I'm so happy to hear your voice and to see your face. It's nice to see you again. I have craziness going on today. So, but thank you for being here.
And, you know, we are a part of the application IDPH has put in even for the PFS and to focus on this issue. So we'll find out in August. That'll be before our next retreat. I did want to apologize to Sarah Persons. I don't think she's on the call, but Children's and Family of Iowa, she actually was on the call, but she was the number, that 641 number that I didn't see it. I saw it for a second pop up, but I didn't know it was her. She didn't, so she did mean to do a hello. She was there earlier. I don't think she's there now, but okay. And you all take a break. Thank you again, Cassie.
Thanks for having me.
Yes, and I want to make sure and tell you at 12:45 we'll start again. I actually won't be here. Stacy's going to lead the call. I have to take my mom to a super important appointment. But AMP will be doing their presentation. That's achieving maximum potential, and then we'll have a couple more state partners like Jane Larkin and Sherry Crone, and then the capacity work group if you're involved in that. So, hey, everybody, thank you again, Cassie. We will stay in touch.
You're
All right.
welcome.
All right,
Bye-bye.
everybody, have a good lunch, and thank you. Have a good rest of your day. Bye.
Thanks, Cassie.
You're welcome.
It just ended. It just ended right now.